Welcome to the 360 Degrees SCD Hub live broadcast show and interactive community chat. This show is designed to do three things. 1. Empower those living with sickle cell disease. 2. Educate the medical community to improve overall care. And 3. Encourage the general public to learn more and how to support this community affected by this disease by downloading our app and joining our community platforms. Whether you are living with sickle cell disease, part of the medical community, or the general public, our goal is to connect and unify everybody to improve care for all. This show is co-hosted by the Sickle Cell Foundation of Arizona and the Force for Health Network. Each month will feature special guests from our partner organizations and will include an interactive way for participants and viewers to interact with us. We encourage you lend your comments on our live streams and to download our free 360-degree SCD Hub app through the QR links below or by visiting our website at 360scdhub.org and join today. Together, we can make a difference for the entire SCD community. Now, let's meet today's co-hosts from the Sickle Cell Foundation and the Force for Health Network.
Welcome, welcome, welcome. This is Lucy Howell, and I am joined here by Moses Akpan, Executive Director of the Sickle Cell Foundation of Arizona. And we are bringing to you our fourth monthly insights, updates, community highlights, member tips, inspiration as we launch our 360 SCD Hub and community platform into motion here. Moses, it's Thursday. We're kind of off a little bit. We usually do this on the first Tuesdays of the month, but July 4th, and then, of course, the family conference affected that schedule. But we are staying on track with a July monthly insights. How are you doing today? Trying to figure out a background.
Can you see me?
Yes, of course. You are live and on stage.
Okay, thank you. I'm doing well. I'm trying to make sure that my screen shows well because it's kind of.
It is all good. The last don't even worry about partner. Okay. What a incredibly busy, exciting month we've had in June with all the activities that we will be recapping today from the Dunbar Pavillion hosted event with the Red Cross that we did earlier, advancing sickle cell together, community roundtable, to the family outreach, a little symposium held last week, over to the family conference that was held up in Phoenix. So we're going to spend a lot of the time today recapping those wonderful events so that in case anybody missed them or is curious to see what some of the recap and highlights were, this is a perfect opportunity to be able to take some of that important information in. We've got Akila backstage that we will bring her in at about 4:15 for her reflections, and we will kind of take a deeper dive into some of the key takeaways and talk about the top 10 reasons to get screened to round out the show, talk about what's upcoming. So those are my opening remarks, Moses. How are you doing today?
I'm doing well. Thank you so much. We are excited to continue to host this event. We hope that it would impact the sickle cell community at home and away. So this has been a very busy June. Yes, and not just busy, a very successful June. As Lucy has mentioned, we had a very successful sickle cell roundtable. We host that event quarterly in partnership with the Red Cross and BANA and other CBOs in the state. We also had family empowerment meeting. We used to have it in person before the pandemic, and we were fortunate to have BANA provide us space so we could meet in person. And so we met there until the pandemic came. And after that, we started meeting virtually, moved from monthly to bi-monthly. So we had that this June, and it was very, very successful. The output of that is going to strengthen our initiative for Family Advisory Committee and also family leadership. In fact, in future, as the event is called Family Empowerment Meeting, it will be run by families. We now have key family leaders who can successfully host that event and take ownership of it. So, and then we also had our family conference. How sweet it was. Who would have known that the event that started in 2019 would have a life of its own and would grow and become so effective? So we are excited. It was successful. I don't have the exact count that it took place. Some came in Friday night because we provided free hotel accommodation for Friday, and the event took place on Saturday 29 and Sunday 30th. So thanks, kudos to Arizona Blood Alliance and other partners, the vendors, FISA, Vertex, so many vendors, whose banner, of course, Banner Network, who supported and sponsored the events, and of course, everyone who participated in that event.
And we're going to take a deeper dive into some of those pictures and key takeaways and guest speakers here in a bit. But, it's interesting. I'm going to just bring some things up to the stage here. We're sitting here in July, which is, we went last year in July is when we met. And we didn't meet, we knew each other, but really this was the start of our project together. And it was interesting to kind of go through concurrently, the development, the selection, the planning, development, and, empower partners. And this whole experience has led to be what will be the foundation of a presentation at the end of the month at the Medicaid Innovation Conference that one of the board members, Sarah, will be presenting. And so it's such a full circle moment to just kind of stop and breathe and see what we've been able to work on, develop, activate, and now sustain and grow. Any comments on this type of graphic, Moses, as we pull things together and take a look back at our 12 months working together?
Yeah, matter of fact, I should give credit to Arizona Department of Health because they play a critical role in our effort and initiatives. As a matter of fact, they represent us on many events that we as organization are not able to do. For example, they had events on the same weekend that we had the Family Education Conference. They had the annual pediatricians conference in Sedona, and they had helped us to create brochures. And so we were represented, even though we didn't go there in person, Arizona Department of Health represented us and circulated the information about the Sickle Cell Foundation. We have a list of activities that have been going on that I wouldn't be able to go over, but I just thought that I give kudos to Fran, the program manager over there, and what's her name? Oh my goodness, how can I forget her? Fullerton.
Fran and Fran's team over at the Arizona Department of Health Services, Newborn Screening Department, is who we worked closely with.
Yes, working very aggressively for us.
I just wanted to bring that graphic up because I think that it's powerful to continue to be able to report on the movement and the development and the growth that we are all working towards, because as you said, and as your mission has always been, you really are looking to empower, connect, and unify the entire ecosystem. So both living with sickle cell, medical community, and general community, and why we should all care about this. I wanted to kind of kick off the show just by doing a recap on Dunbar. Now, this is about a 9.5-minute video, but it's well worth the review together. And afterwards, we're going to go ahead and bring Akila in, and she's going to give some reflections on that and the family event that she did. But let's go ahead and watch this together.
Arizona Community Roundtable Recap. The Force for Health Network celebrates collaborative partnership and effort to combat sickle cell stigma in Tucson. On Friday, June 7th, the Force for Health Network proudly supported an impactful event at the historic Dunbar Pavillion, bringing together community leaders, healthcare professionals, and advocates to address and eliminate the stigma associated with sickle cell disease, SCD. Organized by the Red Cross of Southern Arizona, in partnership with the Sickle Cell Foundation of Arizona, Arizona Blood Alliance, Arizona Achievers Foundation, the Dunbar Pavillion Foundation, and the Force for Health Network, and sponsored by Banner Health Plans and Brother John's Barbecue, this event was a remarkable demonstration of the power of partnership, innovation, and community commitment. In Part 1, the planning team wanted to focus on this single message to the community. Let's address and end SCD stigma now and together. Courtney Slaniker, Executive Director of the Southern Arizona Red Cross, welcomed attendees and provided instructions for the event. She emphasized the importance of community engagement and the collective effort required to address the stigma surrounding SCD. Dr. Knight, psychiatrist from Banner, and Sarah Speakermeyer, COO, Banner Health Plans, shared their professional experiences and insights on the stigma faced by SCD patients. They highlighted the importance of empathy, proper medical training, and community support in overcoming these challenges. Courtney Slaniker, Red Cross of Southern Arizona, Executive Director, states, "We came together today to talk about it, to eliminate it. It's not going to happen overnight. It's going to take collective action to do that, and this is a great start." Dr. Vicki Knight from Banner Health states, "The reality is, for people who know most about the stigma associated with sickle cell disease are those who have experienced this. We have to help. We really appreciate the opportunity to be here today and be part of the discussion." Crystal Jackson, from the American Red Cross, discussed the historical and ongoing stigmas related to blood donation, particularly within the African American community. She emphasized the importance of education and building trust to increase blood donations, crucial for SCD patients. Akila Gilbert, an SCD patient herself and community health worker with the Sickle Cell Foundation of Arizona, shared her personal journey of living with SCD, the stigmas she faced, and the importance of having a supportive community and knowledgeable healthcare providers. Crystal Jackson, Field Director, Red Cross, states, "Education is key to get people to come in to donate, to understand those stigmas, to debunk those, to understand that we're here to save lives." Akila Gilbert, community health worker, Sickle Cell Foundation of Arizona, encouraged those living with sickle cell disease to know your body, know what you need, know the systems, know how to work in it, and don't fight against it. The second half of the community meeting focused on the official launch and celebration of the new 360-degree SCD Hub community app and platform. Moses Akpan, president of the Sickle Cell Foundation of Arizona, opened the session with his personal and passionate reflections of how far his dream has come from his original plan back in 2017. He states, "I am overwhelmed with joy and pride to be able to develop and now deliver this amazing, unifying, and empowering resource to our community. We have come so far. I feel so blessed to be surrounded by such strong partners and look forward to making a difference together." Moses then introduced Lucy Howell, Force for Health Network CEO, joined remotely by co-founder and Chief Medical Officer Dr. Robert Gilio, who helped develop the 360 SCD Hub app, a comprehensive tool designed to empower, educate, and connect the SCD community. Dr. Gilio
interesting.
We got interrupted.
That was an interruption, darn it. Anyways, that full YouTube video is on our site. It's on the 360 SCD TV, and you can access it through the app. And so we'll kind of keep rolling on there. I don't know what happened here. We are still live, and so we will roll with the flow. How's that? Let me bring this back. And so Akila is going to be joining us here in a moment. She was able to be able to participate in all three of the events that we're talking about, right? I got a little flustered here because of that interruption. But yes, so she was able to participate in the Dunbar community event. We had about 65 people, and I thought that the conversion rate on that in terms of people downloading the app and being able to play with our interactive sessions was quite good at about 60-70%. So that was wonderful. And then I think you guys did I know, then there was a support and empowerment meeting that took place. So I'm going to go ahead and bring in Akila now, who we're talking about reality health games and, what it takes to continue these conversations. And I asked Akila to join us to give us some feedback and some reflections. And she agreed, but then she kind of forgot that she was going to be taking care of her own health. So she's going to actually come live from us from her appointment where she is sitting with doing her thing, right? So I'm going to pull you into the main speaker. So Akila, how are you?
I'm good. Good afternoon, everybody.
Wonderful, wonderful. I was sharing with folks that you had a chance to participate and, help lead many of the sessions and facets of what it is that we were doing with this community engagement aspect. You and I had a great conversation yesterday in that, I was showing you all the pictures and you knew everybody. Right. Yeah. And I was like, oh, okay, great. Because the flow of information really is coming in referrals into the Sickle Cell Foundation. It's up to you to kind of go through and make those reach outs. And so as this development or as the community grows, people. So
exactly.
What are some of your feedbacks and takeaways? I know that you had your family support and empowerment meeting too.
Yeah, so I think the roundtable was awesome because we got to do that in our local community here in Tucson and reach out to a lot of different organizations, including like the fraternities and the sororities, the mostly Black, like the Kappas and the Alphas, and we had a pretty good engagement with that. It was really good to see everybody come out and support the Sickle Cell Foundation of Arizona and the American Red Cross and what we were doing with the app and launching that. So that was a wonderful thing to witness. And then just everything that happened there with, people downloading the app and actually using it and participating. It was really encouraging to see that. And then we had the support and empowerment group meeting right before the conference at the end of the month. And so we just invited people to come and tell their story and talk about their triumphs and their struggles, in dealing with sickle cell. And so that was really good. We had a really good turnout. We hadn't done it for a while. The last time we had one was last year. And so having this one in June was just like a relaunch of trying to get them going again so that we can have people know that they're supported and they're not alone in this effort, and doing whatever they need to do. The Sickle Cell Foundation of Arizona is here. We have your back. And so that was an awesome event that Moses and I were both at. And then the conference, our, annual kind of big shebang that we do every year, that was really, really encouraging and really, really I was really excited to see everybody there. It's a time where I get to see the Phoenix families face to face, the ones that I've been talking with all year, get to see them again, just interact. We go to these breakout sessions and, main speaker events. But then, during the whole conference, we get to sit down and actually talk to the families, have dinner with them, and go do activities in the evening. And so it just deepens the connection that we have with them. And I'm always grateful for that. But I think the conference went really good. We got to focus on stigma, we got to focus on advocacy, and we also got to focus on transition. And so those three main things are things that we work on all year. But, when it comes together like that at the conference, it's just really, really great to see.
And I should remind people that not only are you one of the main points of contact for the Sickle Cell Foundation, but you are also living with sickle cell. So,
Yes.
You get to see this from the inside out, kind of,
Right.
you really helped also give great feedback through the development period as well, just reminding us that peer-to-peer support matters.
Right. Yeah.
And that glossary of terms, something as simple as that, would be
Right.
really helpful. I had some key takeaways from the family conference, one of which was never underestimate the power of a single connection.
Right.
I didn't really take pictures, but I videotaped. And so the picture here is not the best quality, but one of the roundtables that we did was on stigma, right? The session of stigma. And one of the comments was just feeling so lost because there was this, and still is this sense of, doctors maybe not being that as prepared as we all want them to be able to see and recognize a sickle cell, maybe pain crisis or a condition when folks come in, and feeling a little lost. She even said, I was feeling lost. I didn't know. She moved here, so it's not like she was here screened and we already were in contact with her. But I pulled this quote: "Once I met Akila, I knew everything was going to be okay." Right.
Yes.
And then also just never underestimate just the power of that personal connection coming in. That was kind of some of my key takeaways. The other one was just, if we would have known, maybe we would have been a little bit more prepared. So this concept of needing to screen, the 10 reasons to get screened. And I want to reserve some time to maybe even just review those as part of this broadcast. But Moses, chime in here. It was wonderful to kind of, for me to firsthand see activation into the community, both in Tucson, Phoenix, and then virtually with the families. What would you like to add?
Well, I don't have the program in front of me. If anybody would like to get a copy of the program, I'm talking about that. Akila right now is receiving care at her annual monthly transfusion, right?
Infusion, yes.
Infusion, exactly. Yes. So that's something folks in the sickle cell community are aware of, or people outside may not be aware of. Every month she goes in and get blood infusion. So, and when we promote blood drive, that's one of the benefits of that we promote and ask our folks to donate blood. Now back to the so it's good to see Akila, our community health worker, working as a client and also working as a community worker, wearing two hats. So when I want to talk to her as a client, I talk to her as a client. When I want to talk to her as a community worker, I talk. Or when I want to do both, we still do both, and thing works as well as it could be. So, and it also shows that a person with sickle cell can live a normal, functional life, and should be an encouragement to others. Now, the The reason we have, there are many reasons, and it would take all day to talk about the benefits, the outcome of having family education weekend conference. Of course, we have grown. So it's not just the sickle cell um, chronic disease, it also includes the hemophilia and other blood disorders. So there is something to be said about the synergy in a group, in a team environment. There's strength in community rather than just being a lonely sickle cell community. And we did that when we started. But now there's strength in coming together. And because after all, the chronic disease um, transcends just the individual disease. You know, pain management is pain management. Transition, even if you didn't have a disease, it's good to understand how you transition from being a young person to being an adult when you are in college and get a job the first time and move away from home. All of those are very impactful. But this family conference was very, very effective. Get to see all our vendors. And there were different breakout sessions. I really would like to email, if anybody's interested, like to send you the program so you could actually see the different breakout sessions. We had time for kids of all ages, different topics of interest. I don't have it in front of me to read to you. But it was also good to see all those vendors that I talked to them on the phone, to see all these people across the board, folks in Phoenix, folks in Tucson, and others from out of state, touching different areas. It was very, very informative. I really value knowledge. You know, we value, and we've heard it said, knowledge is power. The more you know, the better you understand. And that's the reason our app is really integrated into that framework so that you become more empowered, more knowledgeable about these. So sickle cell doesn't look like a mystery, because to some people, even those with sickle cell, it's still a mystery. You know, there was a publication or a material produced by, I think, Pfizer or company, another company, that said that the pain is loud, but the damage is silent. So while a person may be walking around not knowing, thinking that they're doing good, something is still going on inside their body. So important to understand that it impacts our diet, impact our exercise, impact our stress level, all of mental health, all of these things, and including stigma. Stigma is one of those invisible force. It's like a concrete wall. People experience it's like mental health, and they all go together. There's stigma in mental health. There's stigma in other aspects. And so we tend to suffer in silence. You don't want anybody to know that you have sickle cell, or you don't want to tell anybody what you're going through, or nobody listens. So by understanding stigma and knowing how to handle it, we break out of this cocoon. We break out this glass wall that people see us and they don't really know what is going on. Or like a person shows up, like we also had I think the keynote speech was on pain management. Pain it's not written on your forehead for a person with sickle cell. Nobody can look at your face and say, or stand on a balance, like you are trying to balance to see how much you weigh, to see, let's weigh the amount of pain that you may have.
Well, and I think that part of some of the other sitting in on that stigma session was powerful. I mean, there were actually parts where there were several participants crying together with empathy and compassion. You know, when one mother told the story, and kind of like when we were asking, what can we do as a unit to help? You know, she had moved here from Virginia, and she didn't see the same level of awareness of sickle cell when she walked into the local hospitals here in Arizona as perhaps in a more, where she was from, with Virginia. And so not only do we have to teach the doctors, but she mentioned it would be important to teach them on the different types of sickle cell as well, so that that will just be insight into their pain and care prescriptions, right?
Well, those are some of the things that, time have changed and time continue to change. Time doesn't stand still. What happened 20 years ago, 30 years ago, 15 years ago, and so on. We are opportune now. We are fortunate to work with the Banner Hospital family, the Phoenix Children Hospital, the PC, I mean, all of that. So, and we are blessed with hematologists and that are able to take care of our patients and get integrated. For example, a killer is integrated with the K team. She receives schedules from the hospital about client visit. So she's there. She become part of the advocacy, part of empowering, part of the support for the client during their visit. So we've come a long way, and we're still getting better and better. And the hospital is doing their best, really, overcoming some of the challenges. It's not going to happen. All of the challenges, it's not going to disappear overnight. But we are on a really trajectory to success, and we are successful. So it was good to see that opportunity when the families can come together and open up. Like we had those breakout sessions. That's the reason we have the empowerment meeting, and we want the families to run it, to come, and it's terrible to suffer in silence and to suffer alone. Hard enough going through the pain. Nobody can endure your pain for you. But it's even better you can share it, have the opportunity to exhale, let others know what you're going through or what they're also going through. Gives you the encouragement. So we're excited about that.
And I think the other exciting session well, first of all, there were a couple of sessions on launching the app, right? I mean, there was just a opportunity to address the whole crowd and introduce a statewide, community group. They were there for 3 specific inherited rare blood type disorders on behalf of the Arizona Blood Alliance. Sickle cell disease was one of them. Hemophilia was one of them. And then the von Willebrand condition, which was a condition that I had not heard of. So I'm continuing to always be learning my ABCs. So the inability for blood to clot, I guess, is what that is focused on. So the other session, and we talked about the Sigma session, right? But the other session that was pretty cool was the teen transition session. And if we can kind of pull up, I'm going to maybe present a screen here.
I really enjoyed that one with the kids.
That was really
because
beautiful.
they were getting to know. They're getting information that they might not be aware of or might not even know that they need. But once they started engaging, it was pretty cool to just see how interested they were and how they were paying attention and what they did take away from it. So that was pretty cool.
Yeah, I'm going to.
And the introduction of the primary care, which is something we continue to work hard to stress, to advise as part of the medical home. So it was great to have Dr. Newman there and Dr. Hutter leading that discussion, and of course Akila, you being part of that discussion and allowing the young people the forum, the opportunity, space to ask questions. Sometimes they just come and sit and listen. But in that environment, they were able to speak their mind, ask questions, and participate in the discussion or conversation, as I may call it.
Yeah, in fact, I thought it was so good to see. I've done 25 years of conferencing because I've always been in that professional corporate space. And it was like the first time that I got to see like families, teenagers, moms, dads, be able to experience that kind of resorty type of presentation. It wasn't something that was just done down at school. It was a sponsored event for families, right? Your sponsors. There was no cost to the families to attend. And that included food, and that included maybe gas cards. And that included hotel rooms for those who actually needed it. And so that was one of my other big takeaways is like, sometimes I feel like youth go through and they get to college maybe, and they still haven't yet seen an experience of what professional networking or conferencing looks like, as a powerful way to connect with community. And I really think that I'm looking forward to helping, grow that. Akila, I see you kind of nodding your head. Did you kind of agree, or did you want to add anything to that?
No, I was just agreeing with the part that it's really nice to see families doing it together, because there are, in corporate world or wherever where parents are working, they get to maybe see conferences and how it works out. But for a whole family to be able to go to a hotel, have a hotel room, get to go and, enjoy the water park, get to meet other people that, are on the same journey as they are, no matter what age they are. It was good to see the teenagers connect with other teenagers and the families, supporting each other. So I thought that part was awesome too.
Yeah, and it was mentioned a couple times, mainly during the stigma session. Well, first of all, my last comment on the teen transition session is that I personally think that there should be a teen transition session for every single graduating senior, regardless of kind of health condition, because it is such an important part of being an adult, knowing how to take care of your own health without mama or papa making that appointment and, talking to the doctor. You are in adulthood. And it's, some people were, some of the feedback, and I know you've got the surveys, some of the feedback was, yeah, I knew most of this, so I feel pretty good. But, some of the people that were sitting right next to me were like, whoa, I didn't know any of that stuff. This was a really good exercise for me. So I thought that was excellent. And now I go back to kind of one of the key takeaways that I had was just 10 reasons to get screened. And it reminded me of a course that is in the app. And Moses, rather than trying to ask people to email you and get out, I encourage everybody to download the 360 SCD Hub app and just connect as a community, because we can share updates, highlights, files, photos, all the things that we are helping to enrich this ecosystem with will be in the app, right? So
that's what we've
connect.
been promoting. Yes, that's what we promote, including the survey that we are talking about. You send the paper for a person to do the survey. After they finish it, or they just throw it away. Or after they finish it, they will have to mail it back to you, or they don't have compelling reason to send it back to you. So now we've digitized the form. You can go there and complete the form, the survey, and it helps us. You don't need to put your name, just submit it. We put it together, and then we would show the stat, and then we can develop a program. That is really our baseline assessment. When you want to do quality improvement, you have to create a baseline. Okay, this is where I'm starting from, so that you can measure the progress as you go along in the journey. So if you don't have a baseline, it's like there's nothing to compare to. So you start the baseline 3 months from now, or 6 months, you do another survey, 6 months as you progress in that line journey, and you can then integrate all these other resources, whether that's educational or otherwise, that fill in the gaps as individual needed, rather than just shooting in the dark, not knowing which is which.
Right. So, for example, some of the folks in the stigma session were talking about reasons to get screened, why you should maybe encourage your future life mate to get screened if you don't know this, right? That came up a couple different times. And so instead of like, okay, maybe I should go think about that, leave the conference and maybe forget about it, it reminds me that we've got a course, right, on 10 reasons to get screened. So if I were to bring that up right now, we've got a course called 10 Reasons to Get Screened. And we actually did this and we worked with one of Naomi Newman, Dr. Naomi Newman. She's on the board at at the Sickle Cell Foundation of Arizona. She was enthusiastically jumping in, and she activated her residents very quickly and created almost this little activation team. And so we worked with Dr. Linda Osman, who was a first-year resident, and there is a little 2-minute video introduction.
Hi, everyone. My name is Dr. Osman. I'm an internal medicine first-year resident here at the University of Arizona, Phoenix. I'm passionate about hospital medicine, and I plan on staying within the area to continue my practice here as a hospitalist. I completed my undergraduate degree in biochemistry and most of my secondary schooling out in Syracuse, New York. I'm Sudanese American, and I immigrated into America when I was 9 years old. Sickle cell disease is a serious public health problem in Sudan, and its prevalence ranges anywhere from 18 to 30% within the nation's capital, Khartoum alone. One interesting fact that I learned recently was between the years 2000 to 2021, the United States incidence rates were relatively stable. However, globally, there's been around a 13% increase, and that's due to the population growth of Western, Sub-Saharan, African countries, as well as Caribbean nations. And because of that increase, I have an interest in pregnancy planning when it comes to those with the sickle cell trait and disease itself. In the United States, the hemoglobin S gene is carried by 8% of the African American population. So my focus on sickle cell disease stems from both professional and personal interest. Just in my first year alone, I had the pleasure of taking care of multiple sickle cell patients that I met them down in the ED and were later on admitted into the medicine floor. And as a hospitalist, I anticipate further future encounters. Another personal interest is that my best friend is a carrier of the trait. So when she was planning her pregnancy, it was critical for her partner to be screened for the trait as well because of how the disease is passed on. So my goal is to be involved in the Sickle Cell Disease 360 app as a way to provide introductory courses on what it means to have sickle cell trait, how the disease is passed on from one person to the next, and some of the basics that are necessary to take care of sickle cell patients so that we can have safer pregnancies and better hospital admissions in the future. That's all. Take care, guys.
So instead of there are 10 top reasons to be screened in here, right? And instead of reading this in a kind of a boring fashion, I'm going to go ahead and stop share there and bring up this little deal that we can just kind of walk through. I think Moses has just texted me and said that it's major thunder and he may lose screening. So I'm going to continue on the last couple minutes here with you, Akila, right from your chair. And we'll just kind of go and review these top 10 reasons to go get screens. Number 1, genetic understanding, right? Screening helps individuals understand their genetic risk factors, especially crucial for those of African-American, Latino, or Mediterranean descent.
Right.
Number 2, well, family planning. Dr. Osman just mentioned that, one of her best friends is planning a family, and both of them agree that's very important. Knowing your sickle cell status aids in making informed decisions about family planning and reduces the risk of passing the disease to future generations. Number 3, early prevention. Newborn screening allows for early detection and intervention, improving outcomes for children born with sickle cells. I was combining children and sickle. Born sickle cell disease. And again, we mentioned the close relationship and supportive nature coming in from the Arizona Department of Health Services from their newborn screening team to have that directly into Sickle Cell Foundation of Arizona, which is wonderful.
Yeah.
Health empowerment, right? More power means more confidence. Screening empowers individuals to take care of their health and make informed decisions about their medical care. It reminds me of a quote that Moses said at the Dunbar event, where he says, you must love sickle cell. You must love sickle cell, because only then can you appreciate to want to learn more to be able to thrive with it.
Yeah.
Number 5, preventative measures. Early diagnosis enables individuals to access preventive measures and comprehensive care to manage symptoms and complications effectively. Like in the Stigma Roundtable, when you had mother and daughter, I mean, they were really a team together when it came to what they really truly had to do, and making sure that folks understood their plan. If my daughter needs to go get water because it's dry and she's thinking she's hydrated, that is a different condition than other students, right? And we need to know that. Community awareness. Screening promotes community awareness, leading to increased access to resources, support, and advocacy for individuals and families affected by sickle cell disease. I'm going through these kind of quickly, Akila. Stop me if I need to, or if you had a comment.
No, you're good. Yeah, you're doing great.
Reducing stigma. Increasing screening rates helps reduce the stigma and discrimination associated with sickle cell disease by fostering the understanding and the support within the communities. We just talked about that. Reducing stigma is like burning the candle at both ends. There's patient empowerment and knowledge and control, but there's also community education and awareness and empathy, right? And I believe that those two things need to happen if we truly want to impact reducing stigma.
I agree.
Advancing research. Participation in screening contributes to advancing research and improving treatments, ultimately leading to better outcomes and quality of life for individuals with sickle cell disease. I had the pleasure of meeting one of the sponsors, and I know one of your longtime partners, the company Vertex, right? That does the genetic what's the treatment, right? How would you go ahead? Thank you. The gene therapy treatment, and just learning about how science can really impact certain conditions like sickle cell. We should have them on as a guest speaker.
I agree. That would be cool. Yeah.
It was fascinating. What they were saying. And I'm not even going to try and restate it. Exactly. I'm not even going to try and restate it. And for those wondering, our partner in crime, Dr. Robert Gillio, who is normally on these broadcasts with us, he is being patient himself. He's coming through major back and spine surgery out of Rochester in Mayo. So we wish him continued blessings and a speedy recovery. He should be back with us, hopefully on next month's broadcast. Number 9 is health equity. Promoting screening helps address disparities in access to healthcare and resources for minority and underserved communities affected by sickle cell. I think we mentioned also, Akila, the fact that I think it was like 12 or 13 years ago, and I have to go get the specific date, but there was mandatory screening, right, at the newborn screening deal. But if you were born before that, or if you moved in here, and I know that that's your machine going off,
that's another patient,
perfect. Then perhaps you don't know, right? Because it wasn't mandatory earlier than that. So I don't know if a lot of people know this. I mean, I'm in my mid-50s, which means that if you are a 30, 40, or 50-year-old and you've never been screened, they're
I think they started it in the 70s. So a lot of people would be able to, if they don't know their status, they can always go back to where they were born, contact the health department of that state, and they should have their results on file. But if you don't have that, or if your state didn't do it when you were born, you can always, that's a good reason to get tested and get screened.
Yep. And then lastly, taking action. So it really is this kind of proactive nature to take care of what you know about yourself, right? Getting screened for sickle cell disease, encouraging others to do so is the same as a proactive step towards raising awareness, promoting early detection, and improving outcomes for everybody. So as we close out this segment and this session, we've got some exciting things coming up. Like we said, we've got, when we got the interruption earlier, it took away all of the things that I preloaded that I wanted to share. So we're not even gonna fight with that right now. We'll just go ahead and post everything to the app. And so on the horizon, I think that we've got an exciting event coming up for the doctors over at Banner Health. I believe that's July 18th that we're working towards.
I think it's the 17th.
17th or 18th. It's not
Yeah,
really
one of those.
public, so yeah, we don't worry about it. Our Banner Health doctors will know about that. I think things are finalizing. Our next Arizona Community Roundtable is already scheduled for September, so we're finalizing the dates on that. So heads up for that. September is Sickle Cell Awareness Month, and so it'll be good to go on that. We've got we will be launching the monthly family empowerment sessions.
Yes,
I believe on the last Thursdays of the month.
Correct.
So just heads up for that. And again, the easiest way to just connect with all of this is to download the app. And so you'll get notified when we add things that you should know about. And then heads up, the Olympics is coming up.
Right.
And I think it's really cool that built into what we're trying to do here is a fundraiser that we'll be launching with the Sickle Cell Foundation of Arizona, where they'll be part of the Reality Health Games, and half of each ticket sold, $49 for a yearly ticket, will help support the sustainability of this free resource over here. So I think those are the most important pressing deals. We talked about the Dunbar event, which is awesome. The recap video. I'm sorry that got interrupted halfway. It is monsoon season.
Yeah,
right.
That's true. Yeah.
I'm on the northwest side of Tucson, but Moses is way diagonally across Vail.
Yeah.
So it probably is monsooning out there. Thank God we need to break this 110-degree weather.
Please, yes.
And, just working with partners like you that are so committed to even joining us from your,
a little treatment chair.
your treatment chair. That's some serious commitment, Akila. What would you like to share as kind of final and parting thoughts for the folks that you're pretty much really reaching out to, which are those living with sickle cell and the families that have to support and care and love?
I think it's just, to know that you're not alone, that we're here to support you in any way that we can. And that our goal is to make sure that people, know that there's people out there fighting for them. We're going to always be an advocate for you. We're always going to make sure that the education is there so that they can learn more about their situation or things coming on the horizon. And also just to help people be more informed so that they can advocate for themselves, because you're not always going to have a community health worker there to speak on your behalf or whatever, but it's good to know that you have enough support and education and empowerment to advocate for yourself to make sure that you're being treated right in all aspects.
That's right. And I think that the easiest and quickest way to connect with peers and resources is to download, even if you didn't do anything, right? But to connect is so important. And then through that connection, you might be interested in participating in some challenges or, learning to use the trackers. I don't have sickle cell, and I still use the trackers to track my pain in there.
Right. That's awesome.
Because it's a free resource to do so.
Yeah.
So, okay, well, great. It is 5:01, July 11th. We will be back here on August, I believe, if I look at my calendar, at the first Tuesday in August will be August 6th. So remember, it is summertime. So hydrate.
Yes. Yes.
Right? That is our tip, our tip of the month. Hydrate, hydrate. And on behalf of Moses, who had to drop off, the Sickle Cell Foundation of Arizona, Akila, and myself for the Force for Health Network, we wish you a healthy and a fruitful and productive summer. Okay.
Yes. Yeah.
Know your blood, move your blood, give your blood, be kind, be compassionate, and take care of yourself. Okay?
All right.
Great.
Awesome.
Have a great month, everybody, and we will see you next month.
Yes. Look forward to it.